The hum of a hospital is a strange and constant thing. It's the sound of life clinging on, of hope, and sometimes of endings. In this sterile environment, where every second is measured and every breath is a data point, we often forget that death is as natural a process as birth. It's shrouded in fear and uncertainty, a great unknown that many of us are afraid to face. We wonder what it looks like, how we'll know the end is near, and what we're supposed to do when we get there. This story is a journey into that final phase, a way to demystify the process and give you a sense of what to expect. Not as a scary countdown, but as a series of signs that your loved one is transitioning peacefully. I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know so I can make a better video for you now. As the end of life draws near, a profound shift happens. The person you know becomes more and more withdrawn, a natural response as their body begins its final rest. You may find them spending more time asleep, and eventually, they'll become mostly unconscious. It's a peaceful state, like a deep slumber from which they no longer wake. Don't mistake this for a lack of presence. They can still hear you. So it's a perfect time to speak to them, share your memories, and express your love. Another one of the most visible changes you might see is how their face begins to look different. This isn't due to pain or distress, but to the complete relaxation of their muscles. Their eyes may be open or partially open, but they won't be making eye contact with you. Similarly, their mouth will often be open, and their tongue might even hang out slightly. This is because it takes muscular effort to hold your eyes closed, to blink, or to keep your mouth shut. As the body lets go, those muscles fully relax. It's a natural, physiological response that shows their body is entering a state of complete rest. During this time, you may also notice a significant decrease in their food and liquid intake. They may not have eaten or drank anything in several days. It's normal to feel concerned about this, but you don't need to worry. This is a natural part of the process, and forcing them to eat or drink can actually cause discomfort. However, one thing you can do is help with a common side effect of having an open mouth: dryness. You can use a moist cloth or a small sponge to gently moisten their lips, tongue, and gums. This simple act of care can provide a lot of comfort and help ease any feelings of dryness. One of the most noticeable and often frightening signs of active dying is a change in breathing patterns. Instead of the steady, even breaths you're used to, you'll hear different breathing patterns. Their breaths may become shallow, irregular, or even stop for short periods before starting again. This isn't a sign of suffering or that they are suffocating. It's a normal metabolic response as the body's systems begin to shut down. Their body is simply using less oxygen, so the breathing becomes less frequent and more sporadic. Another sound you might hear is what's commonly known as the death rattle. This is a gurgling noise that happens with each breath and can sound alarming. The medical term for this is terminal secretions. This is caused by saliva collecting in the back of the throat. Normally, our brains automatically tell us to swallow this saliva, but at the end of life, this reflex stops working. The body still produces saliva, but it's not being swallowed, so it collects and causes a gurgling sound as air passes over it. It's important to remember that this noise does not cause them pain or discomfort. They are not choking or struggling. To help minimize these secretions and the unsettling sound they make, there are a few things you can do. One of the simplest is repositioning them. You can raise the head of the bed or gently roll them onto their side. This can help the saliva drain naturally from their mouth. In some cases, a doctor or nurse may suggest medication to help dry up the secretions. The key thing to remember is that while it may be upsetting for you to hear, it is not hurting your loved one. You'll know if something is truly bothering them, as they will show physical signs of restlessness or a pained expression on their face. If they are lying peacefully, they are okay. As the body's circulation slows down, you'll start to notice changes in the person's skin. The blood is being directed to the most vital organs, leaving the extremities with less circulation. This can cause a change in the color of the skin, a process called mottling. You'll first notice this on their fingers and toes, which may take on a purplish or grayish mottled appearance. This can also spread to their knees and, in some cases, the tip of their nose. It's an expected part of the dying process and is a visible sign that their body is conserving its energy. Alongside these skin changes, their body's ability to regulate its temperature will also fluctuate. We have a natural sensor that keeps our core temperature at a stable 98.6 degrees, but at the end of life, that sensor stops working as well. You may notice their skin feels hot to the touch, but they feel cold inside, or vice versa. Fevers are also very normal at this time. Again, this is a physiological response, not a sign of infection or suffering. If they do have a fever and appear uncomfortable, you can help with simple cooling measures. A cold cloth on their forehead, behind their knees, or under their arms can provide a great deal of comfort. If a doctor or nurse feels it's necessary, they might also suggest Tylenol suppositories to help with the fever. These changes in skin and temperature are a natural part of the body's final shutdown, and understanding them can help you not to panic when you see them. They are not signs that they are in pain, but rather that the body is making its final preparations. As the body enters its final stage, it's not uncommon to see a sudden burst of energy, or conversely, a deep withdrawal. This is often referred to as terminal restlessness. Your loved one might become agitated, pull at their blankets, or try to get out of bed. They may also be disoriented or seem to be talking to people you can't see. This can be startling to witness, but it's a natural part of the process as the body's systems, particularly the neurological ones, begin to shut down. It's important to approach this with a sense of calm and reassurance. The best thing you can do is to create a soothing environment. Keep the room quiet, with soft lighting. Speak to them in a calm voice, letting them know that you are there and that they are safe. Gentle touch, such as holding their hand or stroking their arm, can also be incredibly comforting. In some cases, a doctor or nurse may recommend a mild sedative to help ease their anxiety and ensure they are not in distress. Another part of this final surge is a deep withdrawal from the world. They may turn their head away, or no longer respond to your voice. This isn't a rejection of you, but rather a sign that they are beginning to let go. Their focus is shifting inward, and they are preparing for the final journey. Continuing to talk to them, even if they don't respond, is important. They can still hear you, and your loving voice will be a guide as they transition. This withdrawal is a sacred and peaceful act, a final preparation for what is to come. The process of dying can feel scary and overwhelming, especially when it's someone you love. The most important thing to remember is that these signs are not reasons to panic. They are the body's way of transitioning. Knowing what to expect gives you the power to be present, to be there for your loved one without fear. Your presence is the most powerful comfort you can offer. This is the time to sit by their side, hold their hand, and share your love. It's not about doing more, but about simply being there. Thanks for watching. Hit the bell icon for the daily updates. Please do like, subscribe, and share with your friends.